Let us now go to visual diagnosis of the limbs. The topic is edema of limbs, the patterns of yin edema and yang edema. Edema of the hands may be due to lung yang deficiency or spleen yang deficiency. In this case, the edema is pitting. If the edema is not pitting, it is due to qi stagnation. If it is due to lung yang deficiency, edema of the hands will have slight pitting, there will be cold hands, slight shortness of breath, slight cough, weak voice, spontaneous daytime sweating, dislike of speaking, bright white complexion, propensity to catching colds, tiredness, feeling of cold, pale and wet tongue with a deep, weak pulse. If it is due to spleen yang deficiency, there will be pitting edema of the hands, cold limbs, weakness of the limbs, poor appetite, slight abdominal distension after eating, tiredness, lassitude, pale complexion, loose stools, feeling cold, and a tongue that is pale and wet with a deep, weak pulse. For liver qi stagnation, there will be non-pitting edema of the hands, cold fingers and toes, hypochondrial or epigastric distension, irritability, moodiness, a feeling of a lump in the throat, premenstrual tension, and a wiry pulse. Edema of the feet. Edema of the feet is usually due to kidney yang deficiency. In this case, the edema is pitting. If the edema is not pitting, it is due to qi stagnation. So we should remember that pitting edema is due to kidney yang deficiency and a non-pitting edema is due to qi stagnation. For yang edema, the symptoms are edema starting from the head and eyelids and then moving to the whole body, the skin looking thinner and bright with scanty urine accompanied with aversion to wind, fever, thin white tongue coating, a superficial tense pulse, sore throat, a red tongue, and a superficial rapid pulse. The pathogenesis is invasion of pathogenic wind. The analysis is the lungs lose their function in dispersing, descending, and regulating the water passage. The water fluid is disordered in distribution, flowing to the skin. The wind and water combines to form the edema, known as the syndrome of wind and water in combination. The key point is sudden onset starting from eyelids and face, edema of the upper body, more serious than that of the lower part, fever, aversion to wind, aching of the body, sore throat, and a superficial pulse. For yin edema, the symptoms are edema with a depression of skin on pressure, pale complexion, scanty urine, edema especially below the lumbus, accompanied with fullness in chest, abdominal distension, poor appetite, loose stools, listlessness, heaviness of the body, pale tongue, white slippery coating, and deep pulse. The pathogenesis and analysis is a prolonged disease causing the deficiency of antipathogenic qi, overwork, overindulgence, and sexual activities. Water is not well transported and transformed by the spleen going downward, so edema starts from the feet and especially severe in lower parts of the body. The middle burner is out of its normal function in transportation and transformation, causing fullness in chest and abdominal distension. Retention of water causes a pale face, listlessness, heaviness of the body, and a white slippery tongue coating. A deep pulse indicates the interior syndrome. Another symptom is edema gets worse day by day, accompanied with soreness and weakness in lumbus and knees, scanty urine, cold limbs, pale flabby tongue with a white slippery coating, and a deep, slow, and weak pulse. The pathogenesis and analysis is kidney yang is damaged by the spleen deficiency, so the edema gets worse day by day. The qi activity of the bladder is not normal, causing scanty urine. In kidney yang deficiency, the body is not warmed, leading to soreness and weakness in the lumbus and knees and cold limbs. Water is flourishing when kidney yang is deficient, causing a pale flabby tongue with a white slippery coating and a deep, slow, weak pulse. As key points, repeated attacks and a long course of edema starting from the feet. Edema of the lower part of the body is more serious than that of the upper part. Thank you so much for your attention.